Hello everyone. I have been asked to give you idea about how to make an audit. So audit is very simple. So having any subject in surgery and study it, masterize the recent guidelines from NICE guidelines or American guidelines, and then define one question. For example, in gallstone pancreatitis, do we follow the guidelines, the gold standard guidelines in hospital regarding management of a gallstone pancreatitis or no? Simply select a duration in your hospital, for example, from 2021 to 2022. Ask the information portal or the archive to give you the patients, all patients who have been admitted with gallstone pancreatitis. This list of the patients, you will go to the medical records and you see the management of gallstone pancreatitis. For example, I selected the compliance with pre-assessment and documentation for long-term management of sigmoid volvulus. How many patients of sigmoid volvulus we have, for example, in any hospital in 2024 or 2023? How do we manage these patients? Have we documented that we offered what is the span of the surgical and non-surgical options for these patients or no? Simple like that. So according to a guidelines I have read before, that you have to do speak to the patient, document even if there is frailty. So I define the audit and I make a very simple method for you here. You can see it. For example, you have introduction, standards, methods, results, and discussion. This is the, I will say, like I will call it the six bullets or six bullet points for covering the audit. Introduction: what is the topic you are talking about? What is the span of management? And then what is the standards of management for this disease? Or what are you following? Or what are you going to talk about? And then what is the aim for this audit? And please note, make it very simple. Simple question, yes or no answer. And then what are you using methods wise? For example, you are giving us idea about the prospective, retrospective collection of data or what? Results, what you found. Are you following the guidelines with 100% of your cases or no? You are lacking behind. And then discuss with colleagues in the clinical governance meeting and have agreement. What is the agreement? Okay, we are following the guidelines only 80%. We need to maximize this to 90 or 100%. What should we do? Should we offer patients? Should we ask the SHOs and the registrars to document and consultants to discuss with patients? And even where frailty is identified, that have been documented in the patient notes or no? So this is sigmoid volvulus, large bowel obstruction, common cause. 3 to 5% of all acute bowel obstruction is due to sigmoid volvulus, and it usually happens above 70 years old. So give clear image, clear introduction like this, and then talk about the standards. What standards you are following or we should follow? For example, you are talking about the Association of Coloproctology of Great Britain and Ireland. Then you give us idea about what is this guidelines said. For example, I highlighted that operative management is individualized, and even because the resection is the gold standard for treatment and it is the optimal approach as a definitive methods of treatment, we should think about it at least because it's very recurrent. And when your patient's admitted initially, when he was fit as a candidate for surgery, and then you didn't offer him any surgery or any offer. I know all of us agree that not more of, like, not most of most of us are not fan of surgical approaches to sigmoid volvulus because of relative all of that. But at some point, with this high recurrence rate of sigmoid volvulus, we require to think about surgery as well. Even where frailty is identified, there should be documentation of the best interest meeting with the patient, and then at least, you know, have discussion with the patient once you've done the successful flexi-segi decompression. Okay, and then I asked myself the question, what is the aim? So, have we done an aesthetic assessment on NILA scoring or PPOSM to say this patient is unfit after assessing his wishes and all of that? Have we documented that we have offered the full span of definitive management and discussed with the patient and clearly documented in their notes, or no? Simple like that. Okay, and then you write the results, and then you talk about the results in like charts, and due to privacy I wouldn't show that, and then discuss with your colleagues, with your consultants in the clinical governance meeting, and that's it. Thank you so much. I hope you enjoyed, and if for any question, please feel free to ask me.